Hey you guys, happy Tuesday. So, on Tuesdays we do Topics and Tips Tuesday. For those of you who are newer to me, I'm Dr. Brittany Weinstock. I'm a family nurse practitioner and founder and CEO of the Nursing Studio. Now, as it's Heart Month, in this scenario, I just kind of want to work through a couple of cardiac issues, but I more so want to also give you the study tip that I'm always talking about, because I commonly run into people just really having difficulty on how to really prepare for the test and how to study, and if they've been unsuccessful before, are they doing something wrong. But the way that I always recommend is, as you're going through the topics, as you're trying to ensure that you're understanding it, breaking it down as assessment, diagnosis, evaluation, and treatment, right? Y'all have heard me say that. If you follow me, I say this. If you have any of my courses or my review book, that's how it's broken down in my book, in my interactive sections. So what I mean by this, and I just want to kind of give it an idea, so as you're even doing like practice questions or studying just content, you can kind of gear your prep in this manner. Okay, so let's talk like heart failure. We can use that because again, it's Heart Month, so I kind of like to hit on these things. I'm not going to go too deep into it, but trying to give you an idea with this. You may hear me do it on pneumonia sometimes or whatever. I try to give you ideas, but I want to kind of give you some versatility and kind of break it down a little bit deeper to see if it helps you when you're studying alone, okay? So when you think about it, hey, you're on the heart failure section, and you're trying to make sure that you're retaining the content accordingly, but also in a fashion that you can prepare for a test question, right? So we start with assessment, and I didn't just pick this stuff. I say this because if you ever receive if you look at their blueprints, if you ever receive the handouts, if you have been unsuccessful, they break it down into this area. Both exams, ANCC is a little bit more detailed, but this is what they're talking about. They're looking to see if you can assess. They want to know if you can come up with an appropriate diagnosis. They want to know if you can evaluate and that you know how to treat, right? So we're talking heart failure. So you want to start thinking that you're the person assessing this patient. So you're going to think as the provider as, hey, if you're a family nurse practitioner, they come into the office, the clinic, whatever, adult gero or whatever, in a hospital setting, whatever your case is, you're encountering this person, you're assessing them. So when you think about heart failure, as you're going through these things, you're trying to evaluate. Do they have lower extremity edema? Any edema? Are they visibly short of breath? Like, do you see them panting as they walked into the office or anything? When you're laying them back on the exam table, are they having difficulty breathing because they're flat? Just different things that in this role, we know how to assess and our common identifiers. But I say this because even when you get test questions, you're not even realizing like, they're testing me to see if I can assess. Because the way they'll present it to you is they're going to give you a scenario, right? So they'll explain it in the fashion of, Mr. Smith walked in the office today, he was short of breath, on exam, there was noted lower extremity edema, 2+ pitting, etc. It might give you a whole list, whatever. So when they're doing that scenario in your mind, that's your assessment. You know what I'm saying? And then when you're talking to the patient, you're trying to further assess. So you're asking for those signs and symptoms. Hey, how many pillows do you sleep on at night? The person might be telling you, hey, I've been feeling more short of breath lately. When I get up to walk to the bathroom, I get so winded so easily. Walking to the mailbox, I can't even make it out here without having to take a break and stop. All that can be a part of the scenario, but I want you to envision yourself as this is you and your patient talking, and this is the information provided. That's the assessment. You're assessing. You know how to assess, right? And then you're going to ask them those signs and symptoms. So in the assessment range, you need to make sure you're studying to know what those identifiers are that classifies with that particular condition. What signs and symptoms may present for this particular condition. So when you're on assessment, I want you to think that as you go through each condition. How do they present and what are their signs and symptoms, okay? So presentation, signs and symptoms. So and what I mean, like in my book, I give you the content, and then I give you sections for interaction. So I say this so you can write it down this way too, just to give you an idea what I mean. I don't know if you can really see this, but like in this area, it gives you the breakdown of the actual content. And then because I like y'all to do content. I like to have all the medicine separate together too. But then I like you to go through and complete the interactive section. And as you see, there's blanks because now that you have the knowledge or you study the content, I want you to go back and you're testing yourself before we get to the practice questions, right? And so as you test yourself on those areas, I want you to stop and go assessment, diagnosis, evaluation, treatment. Now we just covered assessment. So like I said, so when you're thinking of assessment, we are always nurses baseline, right? So we're able to assess. We know when we walk in a room, shoot, when we're in the grocery store, we're assessing people and we're not even trying to because we're naturally trained to do so, right? So when you're doing this, how is their presentation, and then what are the signs and symptoms? So when you read that paragraph scenario on exam, that's what it's going to present yourself to, and I want you to start thinking, all right, assessment. All right, next, diagnosis. Now, diagnosis is now that you have assessed, now that you have gained their signs and symptoms, you're starting to think of these differential diagnoses, right? The diagnoses, right? So the person, lower extremity edema, they were short of breath, yada, yada, yada. So, you're starting to think, all right, congestive heart failure, COPD, anything. You're starting to think all of these different things that may contribute to this. So, you want to kind of ask them more questions, but you're at this stage now, you're starting to show them that you can break down like what diagnostic exams and such to kind of be able to hone in on and solidify your diagnosis, confirm it, right? So things like, what are you doing for those heart failure patients to diagnose? And sometimes it kind of merges over in the evaluation stage. So I don't know if you ever seen the reports, but they'll kind of have it assessment, diagnosis, evaluation, treatment. And they're kind of all, the diagnosis and evaluation are usually together. But anyway, I always say they kind of slightly overlap. And what I mean by that is when you think about a diagnostic exam to help you with those differential diagnoses, that is also a way to evaluate you, right? But again, when you're trying to hone in on that differential diagnosis and confirm the one that you're thinking, so we may be thinking COPD, asthma, they're short of breath, CHF, but you're leaning more towards CHF. So let's think about what you're going to do. You can do your echoes, your BTMP, those chest x-rays, and not in any particular order, but those are common things you're looking for. But you have to know that, like, what are my diagnostic exams? How can I confirm this? Because on the exam it's going to tell you this, or it may ask you, like, what's the next step? And you need to be able to say and pick the correct diagnostic exam that you do based off of those symptoms or the presentation, because that's letting them know, hey, they knew that the assessment showed that this could potentially be congestive heart failure. So they knew that we needed to do an echo. They knew we needed to get a BTMP, etc. Then how are you evaluating this person? Have they had this before? It can go a little bit deeper. What is their ejection fraction? And I'm not asking you to be a cardiologist. I'm just trying to go through these steps because on this scenario, it's a little bit different, but as you go through, you get what I'm saying. And then lastly, treatment. So how are you going to treat, diuretic as they needed? This person on exams had noted edema, so they're going to need a diuretic. Your beta blockers, your ACEs or your ARBs, and just considering where they are. But also what I want to tell you for evaluation also is just thinking about congestive heart failure, knowing that there is an NYHA classification, So how to classify those things too, because that's going to hinge onto your diagnosis and give your evaluation. So for example, if you did the echo, the EF was low, your BTMP was greater than 125, you're starting to think, yeah, looks like congestive heart failure to me, and I'm just giving you basic, just scenarios. But then when you go and you're starting to evaluate and you're thinking about the stages, you're confirming that CHF diagnosis, but you're trying to think of the stages so you can adequately treat them in that fashion. So think stage 1, and I teach y'all about ranges all the time, right? I tell you, all right, know how many there are, know the least and the greatest. So know the lowest end of the scale and the highest end, and then everything else falls in between, right? So with the NYHA classifications for CHF, there's 4 stages. Stage 1, they are asymptomatic. They don't have any symptoms, meaning they're not short of breath. They're not having any of this at rest or on exertion. But stage 4, they have it all the time, at rest and on exertion. So you're thinking like this person who, oh, I cannot lay flat. I sleep on 2 to 3 pillows every night. Oh, I can't even walk to my bathroom in my master bedroom without getting winded. Those are typically your stage 4 people. I mean, and you need stuff a little bit deeper, but on the generic level for testing purposes, this is what I'm telling you. And then stage 2 and 3 falls in between. But they just build on each other. So stage 1, again, asymptomatic. They don't have any symptoms. Stage 2, they'll tell you, you know, sometimes when I'm walking into the store, you know, I park and try to walk into Publix and I get a little winded sometimes, or, you know, things of that nature. Stage 3, they definitely have symptoms. Yeah, if I go to the mailbox, I'm going to get winded, you know. No, I don't have any difficulty sleeping at night, but when I get up and go to that mailbox, I definitely can feel short of breath. And then for stage 4, like I told you, yeah, at rest, I'm short of breath. I feel like I'm drowning if I lay flat. I have to sleep on 2 to 3 pillows, or I'm sleeping in the recliner in my living room. When I'm up trying to make it to the bathroom, I get winded. I barely think I'm going to make it. Stage 4, okay? And then again, your treatment options. And again, I'm just breaking this down in a scenario to kind of give you an idea. And why do I say this? Because again, this is how they're testing you. And commonly we study just to say, all right, oh my goodness, I have all this content, all these resources, and I'm going to do heart failure. Okay, now how do I know these stages? Wait a minute, how do I know how to treat this or whatever? Get yourself in a system. You sit down as you're going through it. You just break it down into those sessions. Okay, when this person, how do they present? So when I see them, do I know any of these things? What are those signs and symptoms? Okay, so did they give those signs and symptoms in the scenario? That's your assessment. What are differential diagnoses? What are diagnostic exams to clarify this and to confirm the diagnosis that I am thinking based on what I see and what you tell me, the subjective and objective in my assessment? All right, how can I evaluate this? And then how will I treat based off of this? And when you get the treatment, don't just know first line, know the second line as well. Think about any allergies and what's your alternative in that case as well, okay? So again, as you're doing it, like I showed you from my review book that I have, I want you to do that as well. Whatever resource you're utilizing, go in that fashion, but I want you to write it out, okay? So then when you get on a test or a practice question, you'll start to see yourself breaking it down into those sections, and you'll see how your scores change and how many things you start to get correct that you were previously getting incorrect. And I hope that's helpful for you guys. Let's just do like another scenario to kind of break it down. Cardiac is kind of hard to do it in that way, but you still can always do it because they're testing you in this way. Let's think blood pressure. Blood pressure is commonly known as the silent killer, but some people do present and tell you, I've been having more headaches more than usual, things of that nature. That can be a side effect, a sign and symptom. I'm sorry, not side effect, sign or symptom. So you may see that. So what are you going to do? You're going to check their blood pressure. Ask them, do they check their blood pressure at home? Advise them to check their blood pressure. See if they have a BP log. Allow them to get a BP log. That's that diagnosis, the diagnostic test, the evaluation, getting them, evaluating their previous BP log, getting them to do one so you can do this evaluation. And then how do you treat? Also in that assessment, you're looking to see, because there's so many identifiers. So you want to assess, are they diabetic? Do they have chronic kidney disease? What is their race, their ethnicity, because we treat differently for those factors. So you're gauging all of this information. So then when you get down to treatment, you're thinking, okay, I know if it was an African American patient, they do better with thiazides and calcium channel blockers. Hey, or is this patient diabetic? I need to consider ACE/ARB, considering kidney function, etc. You know what I mean? So as you go through, again, we're starting with assessment with any category. How do they present? Signs and their signs and symptoms. Diagnosis, thinking of those differential diagnoses, but what diagnostic exams are you doing? Evaluation, how am I evaluating this and considering these factors to confirm the diagnosis that I have along with that diagnostic exam? And then treatment, how do I treat? Knowing first line therapy, second line therapy, and considering allergies as well, okay? So I hope this was helpful for you guys. Just a few topics, tips. You hear me talk about it a lot. But I wanted to kind of break it down like that. Maybe we can do like a little study group sometime so that we can kind of just write these things down. Maybe like I used to do study buddy sessions and things like this is what we would do. Like as we're covering this, we would like go through and do it this way. So I might do that. Let me know if y'all want to start back doing those things. But anyway, try it out. Let me know if it works for you. Tell me how you see the adjustments in your studying and your test scores. Put it in the comments, share. I always like to hear about y'all's improvements, and I hope you found it helpful, and meet me back here next Tuesday. But be sure to share with a friend, colleague, or anybody that you feel like will find this helpful, so that they can prepare and be successful on boards as well. Bye, y'all.